Welcome back. Now, sex workers advocacy groups say that decriminalising sex work can contribute to a reduction in HIV transmission. The groups say that the move would make access to ARVs and healthcare services more accessible. Now, sex workers and stakeholders are meeting at a national conference in Ballito, north of Durban, where the sex work draft bill that looks to decriminalise sex work is being discussed. Now, these sex workers say that decriminalising their work will reduce the level of discrimination and harassment that they face. On the National Sex Work Conference, we're joined now virtually by Human Rights Manager, AIDS Foundation of South Africa, Nontuthuzelo Fuzile. Nontuthuzelo, thanks for your time. Welcome to Morning Live.
Thank you. Thank you for inviting me.
If you could perhaps just let us in on the two-day National Sex Work Conference that started yesterday, why it was convened and what has been discussed so far.
The purpose was to reflect on the journey towards decriminalization of sex work. You may remember that in December 2022, there was a call to decriminalize sex work. There was a draft bill that was publicized for the public to input, and the deadline for that was the 31st of January 2023. Since that time, there had been submissions that were made by the groups that are anti-decriminalization of sex work and by the groups that are in favor of decriminalization of sex work. And those groups that are in favor of that are being led by none other than Sisonke National Movement, supported by like-minded organizations like AIDS Foundation of South Africa and other organizations and development agencies. So with that in mind, and with those submissions made and a lot of mobilization at district, provincial, and community level, we now had to convene in the last 2 days to reflect on that journey, because in the midst of that process in 2023, that was put to a halt by the Department of Justice with the understanding that whatever we may move forward with around 2023, with elections, the national elections approaching, things may change after the elections. So that process could not continue waiting the 7th administration. So we are now in the 7th administration. So it became very important for AIDS Foundation as a convener of this conference to say, let's come together again. This is the 7th administration. There are things that were not finalized. There were things that were left hanging, both at parliamentary and legislative level. So we were here now to reflect on those things, to look at how do we move forward with accelerating the decriminalization of sex work under the 7th administration, not just making another lip service call to say the timeline is now. By December 2025, we want full decriminalization of sex work. Basically, this was the main aim of the conference, and deliberations were done in that context. Thank you.
So what would decriminalisation mean for sex workers in South Africa?
Decriminalisation means their right to full public health, to full health access, to full health equality, not just equality and access, but to their right to access health services, to be acknowledged and recognized, to full health, to full legal and justice services, and also to economic freedom. Those are the most important things. Anything else that happen under those three thematic areas, because at the moment, they are being denied rights to health services in their totality. They are being denied legal support. Instead, they are being harassed, even by law enforcement agencies, including police officers. They don't have economic freedom. Sex work is work. Sex work is an old industry. Some of us were not even born when it started. Our children were not even born when it started, but still it is still regarded as a criminal offense. So if under these three thematic areas, those benefits are being recognized, this is what the call is for. When we talk about decriminalization, we talk about decriminalization in around all these aspects. In economic freedom, we also include not just economic empowerment of sex workers, we include labor. They should be considered under the labor protection. Right now, they are not protected. Right now, they don't have laws that protect and regulate this industry. Right now, they are not even recognized by labor movement as workers. So if we decriminalize sex work, we decriminalize sex work in its full totality. We don't want the part, we don't want a second part, we don't want them to be looked like they are being done a favor. Lastly, before 2007, it was only the part of a seller that was criminalized. In 2007, both the buyer and the seller of sex work was criminalized, meaning that the buyer and the seller, if you look at that clause, it happens at local government level. So all the harassments are happening at law enforcement agency level. So the legal justice part that we are calling for within the decriminalization aspect of sex work speaks exactly to that. We need full protection for sex workers in all diversity. We need full health benefits for sex workers. We need labor rights for sex workers. We need them to be protected and recognized as workers in their industry.
Nontuthuzelo, kindly, give us more clarity. When you say that sex workers are denied access to healthcare, what do you mean by that?
We, as AIDS Foundation, we are involved in this work at different levels. We're involved at technical level, as you see me here, and our management was also here yesterday in support. But outside of that, we are every day mobilizing and advocating for this aspect of our support within our human rights agenda as AIDS Foundation. We have got implementing partners for our human rights and sex work programs that are in 8 provinces in South Africa and in 19 districts of the 25 districts that we are implementing under our Global Fund support. So when we are saying at health facility level, it's because of the violations that are being collected by the implementing partners that we are supporting in these 8 provinces. We get a lot of human rights violations that are perpetuated at health facility levels, where we get a lot of that comes through stigma and discrimination, where health workers sex workers will go to this facility to access service, but instead of being assisted to get what they are looking for, they will be called names that you are coming here now with your STI, for an example, 3 times this week. You were here 4 times last month. Your sex work behavior is really affecting other people because you are now exhausting the services of this clinic. People are being told that every day. So at health facility level, there are clinics, there are health facilities, there are health service points that deny sex workers their right to health services on the basis of them being sex workers. The stigma and discrimination that goes with that contributes to the high rate of HIV infections, contribute to the high rate of HIV-related stigma and discrimination, and hate crimes in second points. So we have got data that proves this because we have got implementing partners for 9 years on the ground looking at violations that have happened against key and vulnerable populations, and sex workers are no different.
Well,
thank you.
Unfortunately, we have to leave it there, but very insightful there. Thanks so much, Nontuthuzelo Fuzile, Human Rights Manager at AIDS Foundation of South Africa, speaking to us about the National Sex Work Conference currently underway in Ballito in Durban.